So in the last section, we looked at the information models for the basal ganglia, and now I'd like to have a quick look at how these information models help us understand the cognitive deficits that result from basal ganglia diseases and damage. Recall that the symptoms of Parkinson's disease are difficulties with voluntary movements and initiation of those movements. And it's known that in Parkinson's, there's a problem with the basal ganglia circuit. Specifically, there's the death of dopaminergic neurons in the SNC, and that eventually leads to reduction in the background dopamine in the striatum. Now recall that dopamine inhibits the D2 neurons. So the death of the dopamine neurons will result in an increase in the activity in the indirect path. That will increase the excitation of the GPI-SNR, and that will increase the inhibition of the thalamus, reducing the ability to release outputs from the cortex. Since it's the release of cortical outputs from the motor cortex that drives voluntary movements, the loss of dopamine neurons will therefore lead to the inability to initiate movement, as observed in Parkinson's patients. The symptoms of hemibalism are jerky limb movements that are involuntary and interfere with the movements the patient is trying to make. It's known that hemibalism involves damage to the subthalamic nucleus, or the STN. Such damage will reduce the excitatory signals going into the GPI-SNR, reducing its activity. This means that the activity of the thalamus will increase, allowing more signals to be released from the cortex. In information terms, that kind of increase means that more than one behavior is being implemented, and multiple implemented motor behaviors means contradictory signals going from the brain to the muscles. Now in the end, a limb can't be moved in more than one direction at once, but rather having a consistent behavior selection by the brain, the incompatibilities have to be resolved in the spinal cord and limbs, leading to jerkiness and so on. Huntington's disease results from a genetic defect that tends to manifest itself around the age 40, and the genetic defect affects the basal ganglia. The symptoms in the early stages are similar to hemibalism, involuntary movements like sudden jerks of limbs. And in the early stages, there is deterioration of the D2 receptors in the striatum, which again will lead to a tendency to select more than one behavior, with resolution having to be made out in the spinal cord, leading to jerky movements. In the case of Tourette's, the symptoms have some general similarity with hemibalism, but in this case the involuntary movements are repetitive muscle contractions, tics, that produce stereotype motor movements or vocal sounds like curses. It's found that drugs reducing the effects of dopamine, one in particular called haloperidol, reduce the symptoms of Tourette's. So if reduction in dopamine improves the symptoms, that implies that in Tourette's, dopamine levels have been increased, or some equivalent effect has taken place. But increased dopamine levels will increase the effect of the direct path relative to the indirect path. And that will reduce the inhibition of the thalamus, making selection of multiple or less appropriate behaviors more likely, the symptoms of Tourette's. So the symptoms of Parkinson's, hemibalism, and Tourette's can all be understood in terms of breakdown of information processes performed by the basal ganglia.